chemotherapy reduces the risk of death from cancer by about a third. The risk of it causing another cancer is very low. So while the risk is there, I think balancing and understanding what those risks are very confusing, but are also very important to understand.
Today, we've been talking about alternative cancer treatments. My next guest is a cancer specialist, and the role of a medical oncologist is to oversee the general care for their patients facing cancer. They specialize in diagnosing and treating cancer with chemotherapy or other medications. Here to explain more is my friend, Dr. George Howard. Thank you, Dr. Howard. I appreciate you coming on.
Thank you for having me.
So, you know, we've been hearing a lot of experts talking about alternative therapies, and we talked before we started taping. You know, what do you tell your patients when they come to you and say, you know, I heard, you know, a Dr. Jimenez, or I heard a Chris Warwick, or I heard a Dr. V? What do you tell them, and what advice do you give them when they say, well, you know, you're telling me about perhaps I need chemotherapy, I'm afraid that I'm going to lose my hair or become terribly sick, and I want to do this instead? What do you tell them?
Well, I think the first thing I would do is kind of take patients who are diagnosed with an advanced cancer, where cancer has spread to other organs and the doctors are only offering them chemotherapy or some form of systemic treatments. When we say use the word chemotherapy, it strikes fear into people's hearts. Chemotherapy can mean biologic therapy, targeted therapy, antibody therapy. So not all of the kind of, this isn't your grandpa's chemo.
And not all chemos are created equal or have as much toxicity or danger. It's really important to understand what he just said.
Exactly. So in that population, you know, where we're looking at patients and we're telling them, look, this is incurable. We want to give you medications to improve your survival, improve your quality of life, and also control the disease, prevent symptoms from the cancer. Many of these patients are going to want to take alternative treatments, and we evaluate them either with naturopathic physicians, integrative medicine folks, to kind of bring in a multidisciplinary approach to these patients' condition.
So this is very unique, because lots of doctors are not like you, and more people are becoming like you and me, where they're becoming integrative. And so the message, I think, from Dr. Howard is that, you know, use the best of all worlds, which is what I really advocate. You know, everything that Chris talked about, everything that Dr. Jimenez talked about, everything Dr. V talked about can be used in conjunction with some of the things that you as a traditional medicine doctor can offer. Wouldn't you agree with that?
I think that science is now kind of out there, and people are seeing, hey, I can do some nutrition therapy. The American Cancer Society recommends cancer patients be on a whole plant-based diet, or as much plant-based food that they can eat.
I have one social media question, and it's from Arizona. Karen from Arizona, and it reads, the American Institute of Cancer Research says radiation and chemotherapy may increase the risk of cancer. And she says, that sounds scary. What does this mean?
So the answer to that question is they can. You know, I mean, let's be honest, you know, there are cancers that are caused by chemo and radiation. They are rare. You know, if you look at, I often talk to patients, breast cancer is a common cancer. We use chemotherapy, and multiple studies across countries all over the world have been pooled together by Oxford University in England. And what they come up with is that chemotherapy reduces the risk of death from cancer by about a third, so 33%. The risk of it causing another cancer is very low. 1 in 100,000, 1 in a million, something like that. So while the risk is there, I think balancing and understanding what those risks are very confusing, but are also very important to understand.
You know, it's super important that, you know, of course, you said right away, yes, it can, but everything in life is about what risk versus benefit, right? Every decision you make, whether you eat those, you know, bag of yellow-colored pops of whatever it is, you know, and put it in your mouth, and I talk to my patients all the time about that. There are risks for that too. So when you take chemotherapy or radiation that could really cure your disease or really benefit you by reducing a cancer, you have to weigh that benefit with the risk. So always appreciate your expertise.
Thank you so much for having me.
Yeah, thanks for coming on. It really clarifies a lot. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.